Bismillahirrahmanirrahim, students. We are going to start our another topic, which is actually counting of eosinophil. Of course, we can count. We can count W basis through new bar chamber, but we use special method to count eosinophil. There are number of reasons for that, because eosinophil is are present in very low amount, and if we have some better method for any other cell or any other procedure, then it will be good to replace the previous from the new one. So total eosinophil count is actually another a slightly changed method from previous total leukocyte count. No doubt, dilution method is also present in this, and but a new role of new bar chamber is actually replaced with another important slide or another important instrument. So let's start the lecture. So what is the principle of eosinophil count? The blood is diluted with a fluid that causes lysis of red cells and stains eosinophil, rendering them readily visible. So there are two functions of diluting fluid here. First of all, lysis of RBCs, and then the staining of eosinophil. So after staining or after coloring of eosinophils, we can observe eosinophil or count eosinophil in easy way or in better way. So lysis of RBC is essential, because without lysis we can interpret our result wrongly, or it will be difficult to count eosinophil due to presence of or due to interference of the red blood cells. So after lysis of red blood cells and after staining of eosinophil, we can count it on a special instrument. Here you can observe some requirements for the this for total eosinophil count. First of all, thoma white cell pipette. We have already studied about the thoma white cell pipette. It's a special type of pipette, graduated pipette, which is actually used for counting or very minor collection of blood. And then another important thing is and important thing is Fuchs Rosenthal counting chamber. Fuchs Rosenthal counting chamber. This is a specially designed chamber for the eosinophil count. So we will see the shape of this chamber in our coming slides. Hinkel's-Mann fluid is used to dilute the sample to lyse the RBCs and to stain the eosinophil. Mechanical counter is also required. We have already discussed, and we have discussed other instrument in our previous. What is the procedure of the eosinophil count? First of all, you have to make the dilution, dilute the sample, or dilution. You can make a dilution in two ways. You can make a dilution in thoma white cell pipette, or you can make a dilution in test tube. If you want to make a dilution in thoma cell pipette, then you have to fill the thoma cell pipette with blood sample up to 0.5 marks. Then after filling at up to 5.5 marks, you have to dilute it with Henkel's-Mann fluid up to 11 marks. So after it is a way to dilute the sample inside the thoma white cell pipette. Now the bulb is diluted over 120. The ratio or dilution ratio is actually is 120 now. So you have to make the dilution ratio 120 in test tube. So if you want to dilute the sample in the test tube, so then what will you do? You will collect 0.02 milliliter of blood in a test tube, and you will mix this 0.02 milliliter of blood with 0.38 milliliter of Henkel's solution. Okay, and then after mixing, you will after gently mixing, you will rotate, after mixing you will rotate or gently mix the this fluid and sample, and then you will charge the counting chamber. You will after charging the counting chamber, or after putting a few drops on counting chamber, you will cover the counting chamber will with cover slip, or with cover slip. And uh, um, after placement of cover slip on microscope, you can observe, you can count the W pieces according to coming formula. According to formula we can see in our next slide. Here there are two things are present in this slide. First of all, you have to you can see a diagram which is actually a chamber, a counting chamber, especially designed for counting of eosinophils. It is only recommended for the counting of eosinophil, but we can in our daily routine hematology laboratory we count WBCs just on new bar chamber. So we are not using a special eosinophil chamber, this FUCH'S Rosenthal chamber, but we should count eosinophil especially on this chamber. But there is another reason to replace this. Automation is also present, so automation can count eosinophil, or we can count eosinophil on on smear as well. So there is nowadays there is no need of there is no need of this chamber in our hematology laboratory, but you should learn the this test for the this manual method of counting to pass your exam. First of all, how will you calculate the eosinophil? So first of all, you will count you will find the diameter, or sorry, volume of one big square. You can observe 16 big square in this diagram, in which each big square is consist of 16 small square. So volume of one big square is equal to because you can see there are square, so length into width into depth is actually a volume. So length is 1 cmm, and the and the width is actually is also 1, and the depth is 0.02. So our answer is 0.2 cmm. So volume is actually volume of FUCH'S Rosenthal chamber is 0.2 cmm. After finding of volume of one square, one big square, we can find volume of whole chamber, which is actually 3.2 centimeter cmm cubic millimeter. Here you can see a formula for the calculation of the eosinophil count after manually counting of eosinophil count on chamber. You will calculate the you will calculate through this formula. But how you will calculate? Suppose n is the number of cell counted. Suppose you have observed n number of cells, n number eosinophils on chamber, then you will multiply the n number of with dilution, and you know a dilution is actually 20. So you will multiply the counted number with 20. After multiplication of n into 20, you will divide the whole answer with a total volume of chamber, and the total volume of chamber is actually 3.2. So you will get the answer. You will you can calculate the total eosinophil count through this formula, and this is actually a most sophisticated way of counting of eosinophil. But again I am saying that nowadays we are not using this method because we have other things, like we have automation in our laboratory. We have staining procedure, we can count eosinophil we can count eosinophil on a smear, blood smear. So we can replace this method with our new advanced method. And the normal values of eosinophil count is 50 to 400 per cubic millimeter. So please keep in mind the units are very compulsory for your counting. After during the time of report, what will you mention with the value of cells? So you should now clearly know the unit, which is actually cubic millimeter. So normal value of eosinophil count is actually 50 to 400 per cubic millimeter. Here is another important thing about the clinical significance. So we can diagnose many diseases on the basis of count of eosinophil count. So which we can say it's actually a clinical importance of the eosinophil counting. What is eosinophilia? Eosinophilia actually is a decrease in number of cells ab- above normal range. Eosinophilia. So eosinophilia actually increase in number of number of cells or eosinophils above normal range. It means eosinophils का upper range से ज़्यादा हो जाना blood के अंदर is actually exactly condition of eosinophilia. There are a number of causes of eosinophilia. In many types of allergic reaction, we can observe increased or enhanced counting of eosinophil our blood. We in many parasitic disease, eosinophil count can be raised in our blood. Few skin diseases are also cause major causes of eosinophilia. Hypereosinophilic syndrome, it means there are some genetically associated syndromes are also present, in which we can genetically body can produce more eosinophil as compared to normal. There is another Hodgkin disease or Hodgkin lymphoma, then eosinophilic leukemia. So there are some important reasons of eosinophilia you should keep in mind. And most importantly, allergic conditions and parasitic diseases are mostly diagnosed on the basis of the eosinophil count. As you know, if eosinophilia is present, so there is another possibility, decrease in number of eosinophil in the blood. So decrease in number of eosinophil is blood is known as eosinopenia. Eosinopenia is actually decrease in number of eosinophil below normal range. We have already studied that there is normal range is 50 to 400,000. So less than 50 cells per cubic millimeter is showing the condition eosinopenia. So eosinopenia can also indicate many type of diseases, or like ACTH therapy. During ACTH therapy, there is a temporary or minor eosinopenia can be observed in case of electric shock and due to effect of insulin hypoglycemia. So due in electric shock, there are chances of eosinopenia. And a hypoglycemia due to insulin is can also cause eosinopenia. So in acute infection, there are increased number of neutrophils, but eosinophil count become low. So this is actually these all are conditions related to eosinopenia. So hopefully you can understand the counting of eosinophil, which is actually very much important in where certain diseases like allergic reactions or in a parasitic infection. Please keep in mind and remember the procedures of the and requirements carefully.